So good morning, good afternoon, and good evening to dignitaries, esteemed guests, and colleagues in Nepal and South Korea, US. I'm Tarun Saluja, working as research scientist in Clinical Assessment and Regulatory Evaluation Unit at IVI. It is indeed a special privilege and a pleasure to welcome you all to this virtual ceremony commemorating signing of Memorandum of Understanding between Nepal Health Research Council, based in Kathmandu, Nepal, and International Vaccine Institute, based in Seoul, Republic of Korea. So, the MoU signing ceremony was supposed to begin with the remark from Dr. Gunanidhi Sharma from Ministry of Health and Population, but unfortunately, due to some emergency, he's running late. So I will request Mr. George Bickerstaff, Chairman of IVI Board of Trustees, who joined us from US, to make a welcome remark, please. Over to you, George.
Thank you for your opening remarks, Dr. Sharma. I'm very pleased to welcome you all to this MoU signing ceremony between the International Vaccine Institute and the Nepal Health Research Council. Thank you, Dr. Gunanidhi Sharma from the Ministry of Health and Population in Nepal for joining us as well. Mr. Ram Shama Thapa from the Embassy of Nepal in Korea, Dr. Pradeep Yawali, and everyone else tuning in from Nepal and Korea to commemorate the beginning of a new, meaningful, and productive partnership between IVI and the NHRC. IVI was established in 1997 with the vision of a world free of suffering from infectious diseases, and Nepal was one of the signatories that signed the IVI Establishment Agreement. We benefited from a long and fruitful relationship with the Nepalese government, universities, and research organizations through our vaccine R&D collaborations to develop sustainable solutions to protect against infectious diseases and other health challenges. Our ongoing and previous efforts with partners in Nepal include significant capacity building efforts to develop health infrastructure and technical know-how, as well as vaccination campaigns to protect vulnerable populations from typhoid and cholera, vaccine effectiveness studies, and data collection to better understand the country's burden of antimicrobial resistance, an urgent and growing threat to human health. Most notably, IVI conducted a phase 3 clinical trial of a new typhoid conjugate vaccine, which was developed at IVI with the aim of achieving MoU pre-qualification to support global public use in typhoid endemic countries like Nepal. With this MoU, we're looking forward to increasing and deepening our collaborations with the NHRC and the government of Nepal, particularly to promote vaccine research and education, build in-country capacity, and to co-develop sustainable solutions to the health challenges that matter. Thank you again for being here, and I very much look forward to the rest of the ceremony.
Thank you, Mr. Bickerstaff. Now we turn to Korea, where Mr. Ram Singh Thapa, Charge d'Affaires, Embassy of Nepal to Korea, will deliver his remark from IVI headquarters in Seoul. Over to you, Mr. Thapa.
Dr. Gunanidhi Sharma, Senior Health Administrator, representative from the Ministry of Health and Population of Nepal. His Excellency Mr. George Bickerstaff, Chairperson of International Vaccine Institute, IVI, Board of Trustees. Dr. Pradeep Gewali, Executive Chief Member, Secretary of Nepal Health Research Center, NHRC. Dr. Jerome Kim, Director General of IVI, other office bearers and staffs of IVI, ladies and gentlemen, Namaste and Anya Hasmika. It gives me immense pleasure to be here in this MoU signing ceremony between Nepal Health Research Center and International Vaccine Institute, IVI. On this occasion, I would like to congratulate NHRC and IVI for their endeavors in reaching out agreements to improve public health system in Nepal. I think that the collaboration between IVI, which has dedicated itself solely in researching, developing, introducing and making availability of vaccines for children in developing countries like Nepal, and NHRC, one of the national apex body of Nepal responsible for quality health research, would be instrumental in improving the health condition of the people of Nepal in the coming days. Signing of MoU of such kind would pave the way for conducting numerous health sectors projects under the partnership between IVI and NHRC. As the health sector has been the priority sector of Nepal, the government recently has laid foundation stone to massively construct well-equipped health center facilities in each and every 753 local level municipalities and rural municipalities. By the end of 2022, every local level people will have a well-equipped health institutions in their own locality. On the other hand, the mass immunization program for children has been excessively successful in Nepal. Every year, the government has been conducting immunization program all over Nepal. Almost all the children below age 5 are vaccinated in this yearly vaccination drive. In this context, the MoU, which is going to be signed today, will give further impetus to collaborate in future programs of promoting and building capacity for vaccine research and education between Nepal and IVI. Through NHRC, Embassy of Nepal in Korea is always ready to facilitate any cooperation planned, designed, and administered between these two respected institutions. Thank you.
Thank you, Mr. Thapa. Now we would like to invite Dr. Pradeep Gyanwali, Executive Chief Member Secretary of NHRC, to introduce NHRC. Over to you, sir.
Namaste, good morning, everybody. Thank you, Dr. Taluja, for this prestigious and nice MoU signing ceremony organization. So, Mr. George Staff, Chairman, Board of Trustees, International Vaccine Institute, Korea. Mr. Ram Singh Thapa, Charge Affairs, Embassy of Nepal to Korea. Dr. Gunit Sharma, Senior Health Administrator, Minister of Health and Population, but unfortunately he is not there due to some emergency work in the ministry. Dr. Jerome King, Team Director General IVI, board members of NHRC, Ethical Review Board Chair, Professor Dr. Prakash Nimire, Research Head, Dr. Meghnad Dimar, Arun Saluja, and my dear colleagues and media people. Thank you very much. So, I'm going to highlight some about NHRC, its areas, different major research projects funded by NHRC and its future plan. So, this is an overview of NHRC and health research governance in Nepal. Next. So, NHRC is a statutory and autonomous apical body as promulgated by the Nepal Health Research Council Act number 29 of the year 1991 of Nepal government. So, it is guided by an executive board, so composed of 13 members, that includes 8 members nominated by Nepal government. So, the members are from medical background and Ayurvedic background, medical doctors, and representatives of Ministry of Health and Population, Ministry of Foreign Affairs, National Planning Commission, Nepal Medical Council, and Institute of Medicine, Tirunelveli University. So it is responsible for conducting and supporting health research with the highest level of ethical standards. So it is subjected to the health policy recommendations to the government of Nepal. So this is the organizational structure of Nepal Health Council. So we have executive board. So under the executive, so there will be an executive chief, So that is the Administrative Chief of NHRC. So I am here to take role responsibility for as an Executive Chief of NHRC. So under the Executive Chief, so there are different subcommittees. So that is nominated by an Executive Board. So we have Ethical Review Board Subcommittee, Health Research and Monitoring Subcommittee, Evidence Generation and Translation Subcommittee. Likewise, we have Communication and Advocacy Subcommittee, so Ayurveda and Complementary Medicine Subcommittee. So these all committees work under the Administrative Chief. So they are independent in their work also. So we have two different divisions under NHRC Executive Board: General Administration and Financial Administration Division. So in that division, we have Financial Administration section, Library and Information section, and General Administration. Whereas in Research Division, we have three major divisions: Research and Program section, Ethical Review and Regulation section, and the Capacity Building section. So under the Research and Regulation Program section, we have Policy Planning and Knowledge Management Unit and Research and Program Unit. Likewise, in Ethical Review Board, we have Ethical Review Unit and Monitoring and Evaluation Unit. So we have four different pillars of the Council. So one is Ethics, Monitoring and Evaluation, and second being the Journal of Nepal Health Research Council, third being Research section, and Capacity Building section. So regarding Ethics, Monitoring and Evaluation Subcommittee pillar, so that is an independent, so that is the Ethical Review Board, so under NHRC Executive. So we have 52 institutional review committees, so under Ethical Review Board in different academic and research institutions. So recently in 2019, so NHRC Ethical Review Board is accredited by FERCAP, so that is Forum of Ethical Review Committee in Asia Pacific region. So we have digital application system in Ethical Review Board, and ethical approval and monitoring is the main function of the Ethical Review Board. And in the journal section, so that is biomedical, peer reviewed, open access, and indexed journal of NHRC. So we will have 4 issues per year, and so that is in cooperation with 4 international editors association. So in the health research section, so that conducts and promotes research, primary research on national priority areas. So under the national priority area, we will do research and we will promote research activities under that section. And we have national and international collaborations between different institutions. And establishment of Center for Excellences is our main motto, and we are working on that. So communication of research findings is also one of the important part of health research section. And in the capacity building section, we have different types of trainings: proposal writing training, data management training, ethical type of training, and so we have health research grants. So for the undergraduate, postgraduate, and the provincial types of grants. So these are the parts of the capacity building sections. So I'm going to highlight some NHRC projects. So recently, Nepal government has declared to develop NHRC as a center for infectious disease and enable it to conduct research on infectious disease control and prevention. So we are working to develop NHRC as a center for the infectious disease activities. And we have population-based cancer registry since 2018. That is successfully ongoing program. So that is supported by Ministry of Health and Population. Nepal Clinical Trial Registry since 2020. So we can do clinical trial registry in our center. So that is the national center. So that is going to be supported by WHO, and that can be accredited soon by WHO also. And one of the important programs under NHRC activities, So that is the annual National Summit of Health and Population Scientists from since 2015. So now, in April 10 to 12, we're going to celebrate our National Summit of Health and Population Scientists in that date. So we are working on that. So you all are invited informally. So now, afterwards, so I will invite you formally in that program also. So we have regular projects. So that is popular in sickle cell disease. So that is ongoing projects. So outbreak investigations and surveillance, non-communicable disease, environmental health, health systems, knowledge management, mental health, communicable disease, traditional and Ayurvedic medicines, and implemented research on universal health coverage. And during COVID pandemic, we do have too many research activities on COVID-19. So we have almost completed more than 15 projects under COVID-19. So for the policy, planning, and COVID type of different activities, so research activities, so we also completed under this project. So this is the area of disease and during pandemic. So we are engaged, or we started the recovery trial. So that is one of the most important clinical trial in COVID-19. So that is run by Oxford University. So in collaboration with Oxford, up to Vietnam, up to Nepal, and NHRC. So we are conducting randomized evaluation of COVID-19 therapy. So that is recovery trial. So we have aspirin, colchicine, and the infliximab. So this type of trial are being conducted by NHRC in collaboration with Oxford University. So we have randomized, double-blind, placebo-controlled treatment for the use of isoquercetin, so plant flavonoids, in the treatment of hospitalized patients with confirmed SARS-CoV-2 coronavirus 2 infection and mild to moderate symptoms of COVID-19. So that is also a clinical trial. Running a phase 2/3 randomized, observer blind, placebo-controlled study to evaluate the efficacy, safety, and immunogenicity of COVID-19 SARS-CoV-2 vaccine in adults aged 18 years and older. So that is also the plan of NHRC. So we are planning. So this is the area. This is the area or arena of digitized. So digitized NHRC is our motto. We are already finalized by the board, and we are working on the digitization process of NHRC and central as well as peripheral. And we have digital data collection and survey, planning, digitation of the data, data repository, data analysis using artificial intelligence, and use of UAV or drone for sample collection. So good learning and teaching platform. So these are under the digitization process. So we are working on that process. So we have daily schedule. So I am showing that schedule. So we are working on the daily schedule and daily calendar. So regarding our future plans, so we will expand NHRC liaison offices in 7 provinces. So during the financial year, fiscal year, so we will have 7 different sub-unit offices in different 7 provinces of Nepal. So we almost developed the project plan and preparatory meetings with concerned authorities conducted. And another future plan is the development of NHRC own laboratory for biomedical research. So that is also our main plan. So coordination with relevant authorities, plan to conduct allopathy, Ayurveda, homeopathic study clinical trials in Nepal. So another plan is the establishment of NHRC Infectious Disease Center. So Government of Nepal has approved consent note and seed money is allocated for work on tropical diseases and HIV/AIDS, integrated disease surveillance, and COVID-19. So another motto or aim of NHRC is to develop its own Center for Excellences. to conduct clinical and different types of research activities in the different sectors, institutions. So collaborative high quality research like clinical trials, epidemiology studies, implementation research, pharmacoeconomic study, etc. Establishing clinical unit and starting joint PhD program in collaboration with different national and international institutions. So we will have a centralized data repository system, development of data repository on COVID-19, including strengthening biobank and clinical trial registry. This is our plan, and enhance journal quality. So use of plagiarism detecting software, collaboration with national and international experts in health research for peer review, trainings, avoiding scientific misconduct, IT application, etc. So with this, I'd like to end my presentations. Thank you to all, IVI chair and IVI DG and our board member and ethical and research colleague, Arun. So thank you very much.
Thank you, Dr. Kianwali. Now we turn to Dr. Jerome Kim, Director General of IVI, to kindly introduce IVI and its activities in Nepal. Over to you, Jerome, please.
Thank you, Tarun, and good morning, and good evening to everyone. This is a brief introduction to the International Vaccine Institute. This is the IVI value proposition, accelerating vaccine research and development for global health. We are an international organization with 36 countries and WHO state parties. 2 additional countries are pending final deposition of their agreements at the UN Treaty Office. And they've already been approved by the Board of Trustees. IVI is located at Seoul National University. We have field programs in 28 countries and a workforce currently of 171, but that's actually planned to go up to over 190 by the summer. So IVI is growing, and we are very, very happy and honored to be partnered with Nepal in a number of very high-profile projects. It's often asked what IVI is, and often it's a very difficult answer, but we are definitely an international organization. We are also a product development partnership, so we move vaccines forward, not just for research purposes, but in order to have vaccines accessible and available to countries around the world that need them at a very reasonable cost. So we bear in mind that vaccines are, in fact, a global public good. We are also a research organization. 75% of IVI's funding comes from research grants that we secure in collaboration with our partners, such as NHRC. This is an illustration of where IVI works around the world, color-coded by program. And actually, the chikungunya program in yellow in Panama, Colombia, and in Thailand actually will be expanding into the Caribbean and Central America in order to fulfill the goals of the research that is funded by the Coalition for Epidemic Preparedness Innovations. It's difficult to describe what IVI does. We operate throughout the value chain of vaccine research and development, from generating evidence of disease burden in the field, doing discovery of new vaccines in the laboratory, testing those vaccines first in animals, and then in vaccine clinical development in human clinical trials from phase 1 to phase 3. With appropriate information on safety and efficacy from phase 3, IVI's vaccines move through regulatory authorities in the country of origin, and ultimately secure pre-qualification approval from the World Health Organization that allows the purchase of these vaccines and their deployment around the world by organizations like Gavi and UNICEF. In this way, we are different from Gavi, UNITAID, the Global Fund, and CEPI. IVI is not a funder of research. We execute research to bring vaccine innovation to countries around the world. This is an example of some of the additional work that we do in the delivery of vaccines. And you can see IVI programs in multiple countries, including Nepal, largely around the prevention of cholera using oral cholera vaccine. This is an illustration of the partners that IVI has around the world, from the government level in Korea and with all of our other governmental partners, universities such as Cambridge, Harvard, Seoul National University, the University of Maryland, and others, with philanthropic organizations like the Bill and Melinda Gates Foundation or the Wellcome Trust, with many global health organizations, including the World Health Organization, UNICEF, Gavi, CEPI, and the Korean Right Fund, Research Investment and Global Health Technologies Fund. As well, IVI cannot do its job without strong partnerships with manufacturers, particularly developing country manufacturers that will bring these vaccines at high quality into stockpiles and be used for global health purposes. So what does IVI do in Nepal? Nepal had been one of the signatory countries to the IVI treaty from its inception. We started working with Nepal in 2011 when we signed an agreement to strengthen Nepal's National Committee on Immunization Practice, essentially a committee that helps to recommend vaccines for use in Nepal. IVI also has conducted a number of vaccination campaigns both against typhoid and cholera in collaboration with various parts of the Nepalese government, within school districts, with the Ministry of Health, and then with the Ministry of Health in Dading and Nuwakot after an earthquake in 2015. Because of our interest in hepatitis E and the significant prevalence of hepatitis E in Nepal, we've been trying to move forward a vaccine against hepatitis E and sponsored a hepatitis E symposium. The Gates Foundation has once again recognized the potential global burden of hepatitis E and given the EPIC unit at IVI additional funding for work, at least to explore what is necessary in order to move a vaccine for hepatitis E forward. In 2019, the EPIC unit again developed a program to work on antimicrobial resistance in Nepal as a part of a Fleming Fund, a United Kingdom funded effort that we know locally here at IVI and in Nepal as Captura. There were a number of brand new cholera control projects funded by COICA. It's known by the acronym ECHO, Enhancing Cholera Control in Nepal. It's actually also being conducted in Mozambique as a part of an effort funded by the Global Disease Eradication Fund in Korea. Through a significant effort on the part of many scientists at IVI, including very notably Dr. Saluja, who is in this ceremony today, we were able to stand up a capacity to do phase 3 trials for the typhoid conjugate vaccine made by SK Bioscience here in Korea to be tested in Nepal. That study was done remarkably well. People were enrolled, the study was conducted, a review of the study was done by an external agency, and we found that the Nepalese sites did beautifully. And it so impressed the Gates Foundation that the Gates Foundation supported a grant to prepare Nepalese sites for potential phase 3 trials testing COVID-19 vaccines. And we're hoping that very soon a new trial conducted by IVI with the Nepalese government will test a new COVID-19 vaccine in several sites within Nepal. We will now commit IVI to assist NHRC and other Nepalese agencies in collaborative grants to build research and development capacity for vaccines in Nepal. We will promote research activities and work on research infrastructure and training. We will work to build sustainable solutions to Nepal's public health challenges, and we together will look into the possibility of establishing a collaborative research center, an IVI collaborating center, if you will, with the NHRC in Nepal in the next year. Thank you very much.
Thank you, Dr. Kim. Now it's time you all are waiting for. I would like to invite IVI Director General Dr. Jerome Kim and NHRC Executive Chief Dr. Pradeep Gyanmali to approach the table for the Memorandum of Understanding signing ceremony. Please, sir. Yes, please. Yes, please.
Thank you.
Congratulations to both NHRC and IVI for the historic moment. Now may I request everyone to please gather here at the signing table for a photo session, please. Please. Thank you very much. So dear participants from Nepal, Korea, and US, this concludes the live coverage of the ceremony commemorating the signing of MoU between NHRC and IVI. Thank you for your participation. Stay safe, stay healthy. Thank you. Kamsahamnida. Namaste. Sign off, please.